Talking about the concept of splenitis. Splenitis. So one thing is, whenever you see a word, like let me say splenitis now, yes, you can derive the word spleen from splenitis. Then anytime you see itis, it simply means what? Inflammation. So let me say if you are talking about splenitis, splenitis is simply the inflammation of the spleen, okay? So we'll be looking at concepts around this term, like the types, like the causes, the symptoms, the diagnosis, and possible treatments of what? A spleen that is inflamed. For the definition, we said that splenitis is the inflammation of the spleen. It's often caused by things like what? Infections, trauma, or autoimmune disorders, okay? What are the types? Of course, it could be infectious splenitis, which is caused by things like what? Bacteria, viral, fungal. Could be non-infectious like autoimmune, okay, diseases or inflammatory ones. Then there could be traumatic splenitis. This one is like there's a physical accident, okay? So what could be the possible causes? We have already listed them even in the definition, okay? So just going over again, could be infections like mononucleosis, it could be what? Tuberculosis. It could be autoimmune disease like what? Systemic lupus erythematosus, could be rheumatoid arthritis. Could be trauma like splenic injury, could be inflammatory conditions like what? Sarcoidosis. So actually spread to the spleen. Could be cancer. All right. Then symptoms now. Looking at the symptoms, if somebody has an inflamed spleen, what would they complain about? And what would you see on physical examination? Okay. So abdominal pain, fever, fatigue, weight loss, splenomegaly. That means the spleen will be enlarged, just like this. Okay. So this is how your normal spleen should be like, and this is a spleen in splenitis. Now, diagnosis. How can you be able to confirm that this thing actually exists? So physical examination, imaging studies, blood tests, biopsies can also help. Treatment. You give antibiotics if you are dealing with what? Infectious splenitis. Then anti-inflammatory medications, immunosuppressive therapy for autoimmune disorders, right? The splenectomy, if the case is too severe, you might just have to what? Cut out the whole spleen. There's supportive care, all right? So complications is could lead to splenic rupture, abscess formation, sepsis, and hyper splenism. That's excessive spleen activity. All right. So that's it for this concept known as what? Splenitis. See you guys.